Hello, thank you very much for joining this podcast or videocast. I'm Allan Wardhaugh. I'm a paediatric intensive care consultant by clinical background, but my job these days is with Welsh Government in the implementation of the National Clinical Framework for Wales. I was part of a small team that helped to inform the writing of that document, which was published at the beginning of 2020, and I'm now leading its establishment and its implementation. I've recorded a series of short videos which hopefully will act as a good explainer and introduction to the concepts of the National Clinical Framework, and in this series I'm going to eventually concentrate in a bit more detail in how this relates to the primary care community specifically. There is a core vision to the National Clinical Framework. Our aim is the aim that we've had for a number of years now across the system, which is to deliver the quadruple aim. So that's the objective, if you like. The strategy is to build a learning health and care system, employing the philosophical principles of prudent healthcare, which again, most people within the NHS in Wales are familiar. So I'm using this slide to try and illustrate that value-based healthcare and prudent healthcare run throughout the National Clinical Framework and are joined together by it. The National Clinical Framework itself is the learning health and care system, and it brings together those philosophical principles and that value-based healthcare way of building things. And that's the forward vision for the NHS and the care sector in Wales. I'm going to talk a little bit more now about the learning health and care system. And this circle on the slide illustrates the three main sectors: practice to data, data to knowledge, and knowledge to practice. Practice to data is how we use digital technology to improve and become more efficient at collecting data, recording all of our clinical interactions. That isn't just about making notes and recording information during face-to-face exchanges, but actually encompasses putting together data from population resources, from patient-held apps, from personal health records, and to use that to inform the system. Having collected all that data, we can then turn that into knowledge. But turning data into information and knowledge is a process. It doesn't happen by magic. And this certainly is an element that we're going to need to build both capacity and capability for across the system. This is about employing people specifically with data analytic skills, but it's also about upskilling existing clinical staff and managerial staff to become more data literate and to become better at deriving insights and understanding from the data that we're collecting. Having done that, we need to be able to translate the knowledge that we've gained from that data, particularly the outcome data, to re-inform how we practice. And this is the element that is really going to involve you in primary care and clinicians in many other settings, because this is where clinical networks are involved in taking that information, taking that knowledge, redesigning pathways of care, re-informing how we deliver services at health board and primary care cluster level, and then the process begins again. I think it's important to emphasise that as well as the learning health and care system being a data-driven process like this, it's also a philosophical principle. We accept that everything we do is something we need to learn from and iterate so that we don't necessarily achieve perfection first time round, but we need to use ongoing quality improvement or PDSA cycles, which I think it's clear that this illustrates. This next slide just emphasises the fact that in order to collect data in the way that we've described and turn it into information and knowledge, we need to be able to do so in a much more shareable and accessible way than we've been able to do to date. And that's what the National Data Resource Programme is about. And in later episodes in this series, we'll talk a little bit more detail about that. This diagram shows schematically how that learning, health and care system fits in to the governance structures of the health and care system. At the top, we have the NHS executive function as part of Welsh Government, and that's where priorities are set. And later on in the process, that's where accountability will be held. But working very closely within and adjacent to the NHS executive will be national clinical networks. The word clinical, I'll talk about in later videos, is a very broad term. So it's not just doctors, nurses, allied health professionals. It involves colleagues in social care, local authority, operational management colleagues. It's a very broad church. Those national clinical networks, because of their broad base, will have a broad outlook and will describe the standards and the outcomes expected of their services, and will also design high-level, whole system, whole lifespan healthcare pathways through which the services will be delivered. It will be the job of the local planning and delivery organisations, so that's the health boards, regional alliance structures and primary care clusters, regional partnership boards, those entities, to localise those pathways, localise them appropriate to the demography and the geography of the areas where they operate. Accountability will flow back up to the NHS executive, but will still involve those national clinical networks. So I think you can see in this diagram that the national clinical networks are going to play a very key, important role in shaping how we design our service and determining how we learn and improve our service. This final diagram just gives an outline of the proposed programme structure for the establishment of the National Clinical Framework. There are 4 main work streams, and I'm highlighting them here because these are going to form the basis of the next videos that you can see in the series. The next video will deal with work streams 1 to 3, and the following video will deal with work stream 4, which is all about how things join up and how about governance works. And then a final one in the series will be around workforce and digital, before we move on then to specifically talking about how primary care clusters are involved in the process. Thanks very much.